A warm good morning to one and all. Today, we have an important topic to be discussed. This is on part of the Empire Dental Education Unit's webinar series on outcome based education. Today, we have an esteemed speaker from Sri Ramachandra University, and she will be addressing on competency based education, which is also one of the important part of the OBE. Uh, well, uh, about the topic about this one, I think we can keep it at the end of the discussion, how it is going to help us in the field of dentistry. So we have a person from the dentistry who has already done it, who has done a PhD on the same topic. I would be happy if all of you get some positives out of this meeting and we implement the same in our college as well. Without further ado, I would like to request Dr. Migdad Tangal, the Assistant Professor, Department of Oral Pathology, to start the day's proceeding with the invocation. Over to you, Migdad.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ألم نشرح لك صدرك ووضعنا عنك وزرك الذي أنقض ظهرك ورفعنا لك ذكرك فإن مع العسر يسرا إن مع العسر يسرا فإذا فرغت فانصب وإلى ربك فارغب.
Thank you, Migdad, for the invocation. Well, a program like this would not have been successful or would not have been conceived without the support of our dean, Dr. Akhtar Hussain sir, who has been always in the forefront. The Enapaya Dental Education Unit was established with his efforts and definitely with all the efforts of all the members. And thank you, sir, for giving all the support and trying us to improve the education, especially in the field of dentistry as well. Now, I would like to request Dr. Akhtar Hussain sir to give the inaugural address before the start of the program.
For the day, Dr. Anbarasi, the faculty members, interns, ladies and gentlemen, a very good morning to you all. Dental education was previously structured in such a way that students largely learned what they chose. The aim was to produce a dentist with a prescribed package of knowledge upon graduation. The traditional approach was more of a disciplinary-based kind of a teaching all this time which we've been doing. Increasingly now, the current trend is towards competency-based education, which provides a sequence of defined learning experiences to students. Here, the learners take responsibility for their own learning and are motivated by a feedback affirmation of the growth, of affirmation of the worth. The purpose of OBE is to increase the knowledge and skills of the learners. We have to understand one thing: the need to transform the students to dentists so that the graduation may be considered as a qualified beginners in the dental practice. So here the learning involves a team of students in an open-ended assignments or projects that resembles some problems students may face at their work in the real world. So it teaches the students the importance of taking a healthy risk instead of doing activities that which they normally comfortable with. So changing an existing situation is not easy. The adaptation to a competency-based learning requires the reassessment and revision of the entire curriculum, except maybe some common ground between traditional and competency-based education, but the entire thing has to be revamped and takes some time too. So in every aspect of a fast-growing world, we know that not to advance is actually going back. So we need to accept the changes that's happening. So multiple teaching strategies have to be used in order to develop an effective dental education, and the teachers have to be innovative and creative in designing the program. These things may seem a little difficult to start with, a little strange too. For that, we have with us today an eminent person on this field, Dr. Anbarasi from Ramachandra Dental College, on the topic designing for success with competency-based education. While thanking her, I wish deliberations an interesting day ahead, and I congratulate the team of Ennapoya Education team, Dr. Imran, Dr. Vidya, Dr. Vinita, Dr. Migdad, and others. And thank you. All the best for today's program. Thank you.
Thank you very much, sir, for enlightening us and also telling us, being currently in the teaching profession is a change which we have to adopt and which we have to innovate. Uh, Thank you, sir. Thank you for emphasizing. Now we have a speaker.
Today topic for discussion is designing for success with competency-based dental education. So designing for success, we are not going to talk about competency-based education because already we are in a level to execute it. Anytime our DCA may ask us to go for competency-based education. So now we have to design for success. There is no point whether it is necessary, whether it is not necessary, no argument. So we are in a step to implement it. So for that we need to prepare ourselves by designing the success. So today the presentation will be on the title validation, why the design is necessary, and a very quick review about the traditional and competency-based education and what are the design principles in competency-based education, and not a take-home message but take-home assignment and a vibrant discussion. Design is, so what design? It is a very precise arrangement of the preferred components in a structure. So everything should be very precisely planned and very precisely arranged. And the preference might be from both the manufacturer, that is what are the features he wants to give for the stakeholders, and the preference of the stakeholders, what they expect from the product. So it is the preference of both the manufacturers as well as the stakeholders in a product in a very precise manner. Then if it is done properly, it will hit the market. Because we deserve design and we go for design in each and every small thing what we are purchasing. So I feel that this concept is very well go with education also. No more we can sit and go and do the didactic lectures or small group discussion and the routine essay, short notes kind of assessment. So we need to design for our stakeholders what they wish. Now, if we fail to design, what will happen? Our council will give our guide of how to go with competency-based mapping for the dentistry. But we will be using the old teaching method. So I will be having a competency-based manual on my left hand, but on my right hand I will be using the old traditional method. So it will not match. We will be saying that we are doing competency-based, but actually it will not happen. Or else, one day suddenly I am forced to go for the competency-based education. Fine, I don't have any preparation. Then I may look for the institution which already implemented the competency-based education. So I may pick up a few points from them, few points from some other, and make a design and execute. If I do so, something goes wrong. I don't know how to correct it. No one can correct it, and there is no guarantee for success. So it's high time for us to design our own program to face the council necessity and to implement the competency-based education in our institution. So what the competency-based education at all means? So it organizes the academic content according to competencies, not by the topics. For example, it will not say that you have to go through the partial denture, or you have to go through the erythematous lesions, or you have to go through the class to cavity preparation with the amalgam. So it's not like that. So it will see the competences. For example, the student should treat a patient with a partial denture. The student should able to diagnose the erythematous lesion. The student should treat a patient with class to cavity preparation and amalgam restoration. So this is the competencies. So basically there is a shift from the topic towards the competencies. Second thing, the curriculum emphasizes what the learners are expected to do rather than what they are expected to know. So it's basically doable things. if we differentiate where we are and where we are going to be. The focus in traditional or discipline-based education is very narrow domains, only knowledge and skill. So we expect the student should know certain things, the student should perform certain things. But in the competency-based, we used to give more importance for the fundamental academic knowledges and engage students in deeper learning. Like fundamental academic knowledge means they should able to do the, for example, values of education, their attitude, their importance, and how they are interested. So all the basic qualities that should be incorporated, that only will generate the deeper learning. And then the end result in traditional education is, it's fixed whether you are a pass or fail, winner or loser. So it will give rise to a pattern of inequality. So the loser again will write the exam, he will become a winner. So that is the thing. So there is no proper quality. But in the competency, it has to be defined that every student should demonstrate their mastery level of skills. So once if they become ready for the standards of the profession, then only they are allowed to start their practice. So it is not pass fail. Everybody is pass, but they should demonstrate the competencies at the mastery level. So that is a basic difference in the end result. And the support what the students are getting in traditional education is in the form of remedial learning, that too occur when they lose the subject, not at the throughout the course time, only at the end. But in the base of competency, it depends more on the formative assessments. So if the students are identified that they are struggling at a particular level, this teacher has to give a very effective feedback and a proper comments to correct himself, so that now and then the student will correct his mistakes and he will go in the flow. Regarding the pedagogy, in the traditional, it is based on the study phase, whether the student is in the first year, second year, third year, or final year, or he is in the first internal assessment portion, or he is in the second internal phase, or he is in the third phase of the internal assessment course duration. So it's not actually seeing the need of the student. But here we have to see where the student is standing. So from that point, we have to design an instructional strategy for the particular student and then take him. So we cannot fit that on the time basis. Regarding the assessment, the traditional wholly believes on the summative assessment. So we used to conduct 3 internal assessment as a form of summative, and finally the university exam as a summative mode. But here it gives more important for the formative assessments. So the students need to practice when they are not yet competent. So they should prove their competence in each skill, and then only they can move to the next level. So again, curriculum. So the present curriculum is giving your objectives and what the performance are expected. So with that it closes. So what is the course objective? What is the expected outcomes from the student? Otherwise it is not giving any clue for the students. But in the competency, it will be very transparent and it will give the clear and explicit idea for the learners that what they are expected. What is their course outcome? What is the outcome of the student at the end of 4 years? To reach that outcome, what the learning cycle they are going to undergo and how they will be assessed whether the learning outcome is received or not, or it is taken by them or not, and in the assessment how they are going to be assessed. So everything will be clearly communicated to the students. So expected outcome to the way of learning, assessment, and what is the competency, everything will be clearly defined to the students. So that is a basic difference in the curriculum. And timing, if you see the traditional, the institutions will move the students in batches. So the content, course, everything will be same for all students in the batch. Once if they finish 1 year, they go to the next year. If they become finish the course by passing the summative examinations. But here it is more personalized. In the competency base, the student should demonstrate mastery of the learning, then only they will be taken to the next step. And if something goes wrong, if they are not able to do that, additional support should be given for the student to finish the target. So they cannot go in batches. So individual and personalization is mandatory in the competency. So if we see competency alone, we need to give more importance for the functional knowledges, that is foundational knowledges, and we should see the mastery of the competencies, and we should give additional support for the students based on the formative assessment, and we should start our program where the students are standing. Accordingly, we have to start the topics, give more weightage for the formative assessment, and we need to get a transparent guidance, and that should be communicated to the students. And finally, we should not depend on the time. We should give enough time and space for the students to reach the targets. So now we are in an hour to respond to the new profile of Indian dentists. That is, no more they will do the repetition of movements what the faculty is doing. They will follow the logical action steps, and they won't go for the exam-oriented knowledge. They will go for the very systematic education and reflective practice. From the objective-based assessment, the students are going to face or attend for the outcome-based assessments. And finally, the end results of Indian dental education is not a mixed range of performers, all competent performers. And that is the goodness of competency-based dental education. So, to put it in a nutshell, in the traditional, the work completion is based on number. The word quota, so that is the thing which is hitting the students' mind. They have to finish number of exercises in each subject, each clinics, and once if they finish that, and once if they attain 80% of the classes, then they are allowed to go for the exam. And then again, if they come to the border level, just 1 or 2 marks it will be added, and again they will be pushed towards it. So the end result is a low achievement and educational inequality. So that is the end result of our present scenario. But if we implement competency-based education, what happens? We have to personalize the learning method according to the need of the students. So it will give you flexibility and supports the students to meet the mastery level, so that highest standard is possible for our community. So this is a very key essential point for the implementing competency-based education. That is the high standards of the Indian dental graduates. Now move on to the competency-based training. So before that, just simply to put competency-based education, what it means. So if you say a person is competent, it means that the person can do something. So the do something is our content. And the person can do it well. That is the assessment. So how he do is the assessment. So the content and assessment. So the competency is the actual something that the person is doing and that can be observed. So that is the competency. Based means it is founded upon or built upon. So competency based means the program is built upon the learner doing things that are observable. So every student should perform, and the performance should be observable. So these are the two basic things. Education is the thing we have to train the students to do things, otherwise they cannot do that. So without training, they cannot do that particular performance. So this is the basics of the competency-based education. So the person should do something, and that something should be observable, and that something cannot be done without training. So this is the basics of the competency-based education. What we are telling, what is competency-based, what is competency-based, this is the competency-based. So the DCA getting ready to launch the competency-based education. But for the institutions, it's a challenge. Why? Because the new format is entirely different in every way from the traditional program. So being an educator, we are doing this business for years, and we all feel that we are experienced and competent to teach what has to be delivered to the students. So now moving from the current position and start from the scratch will not be attractive for the faculty members. So we cannot easily accept this change. And second thing, the teachers are used to be the source of power, the source of knowledge, and the source of learning. So the student has to depend on the teacher for everything. Yes, power. They are the one who decides the pass and fail. Source of knowledge. Yes, they are the one who determines what they have to read, what they have to do in the clinics, what they have to do at exams. And they are the source of learning. They have to prescribe the books that only the students can go and learn. So everything, it is teacher dependent. So now it is a time when the competency-based education is implemented. They have to step back from the front of the room to the group. That is they have to mingle with the students. And to accomplish all this, we need a lot of training. That is, the faculty should have a growth mindset, shared vision, code of cooperation, and standard operating procedures, and faculty development workshops. This is all very mandatory, and it has to be started very soon. Because I'll tell, to implement the competency-based education, Royal College really took more than 30 months after they decided to plan and to pre-implement. That is the prior proper implementation, the trial implementation. For those period, it has 30 plus months they have taken. So I think it's the right time for us to start the preparation. Now the designing principle, how the institution should design competency-based education according to their own scenario. So every institution should think that on three bases. One is the purpose design. Second thing is they have to design the teaching and learning methods. Third thing is they have to design the structure. Now, I will see what is the purpose design. The competency-based education emphasizes the commitment to every student's success. It means that there is no pass fail. Either do or don't. So the student has to continue the dentistry or not. If he continues, he has to be competent. There is no leverage in that. So it emphasizes the success of every student. So the success here is not pass fail. Again, it is a competent success. So what we mean by competent success is, it is the definition of success that include academic knowledge and transferable competencies. Whatever they learn, whatever they perform, that should be transformed into the real practice. And the skills to be a lifelong learner. So the lifelong learners is not just to improvise the subject knowledge throughout the period. It is the thing if they face some difficulty in the real life. For example, how to solve the conflicts, how to be a leadership quality. So these are all the things what they are going to keep face on their practice. So those kind of learning should be given. So they should be trained during the student period. Then only they can build on it and become a lifelong learner. So those qualities also should be implemented as a part of our training. So the transferable academic knowledge, competencies, as well as the lifelong learning skills. So these are the main purpose of the student success in the competency-based mode. So this is the purpose of the institution. So we need to produce every student, all 100 students should be successful in transferring their knowledge, in transferring their skill and their lifelong learning qualities. So how to do about it? So first we need to change our classrooms. No more didactic lectures, no more small group discussion. It should be an active learning environment. So the student should go and seek out things and find the resources. So it's not that everything is prescribed. It is not that one textbook based thing. It is not that the teacher will come and deliver based on that they can go and prepare for the exam. No, it's an active learning environment. Both the teacher and the student should prepare for the class. So both should come with the new points. So it is a together learning. So that active learning environment need to be implemented. Second is learning should go beyond the classrooms. It's not only within the campus. So we need to find how to extend our learning, our students' learning outside the campus. So any collaboration or any real life experience or any other form that we can provide for the students. It's not again only the blended mode of certain things I give online. That doesn't mean that it is learning beyond the classroom. So we have to expand the opportunities. So it has to be the student should go to some other universities, or the student should go and observe in community basis. They should stay back. So a lot of new innovative things we have to make in our system to bring the education outside the campus. And third, we have to uncover and address the bias. In the today's system, consciously or unconsciously, every faculty is having a lot of bias in their mindset. So that should be addressed and uncovered, because we are having very structured duty. So here there should not be chance for the bias. Then it will spoil the entire system. And then we have to create a safe environment. Once the student enter into our campus, they feel that they are valued, they are respected, and they have a very good relation with the fellow students and the faculty member. Only in that environment, this kind of learning is possible. Otherwise, if they're not feeling that they are not respected, if they feel that they are cheated, if they feel that they are neglected, then there won't be any openness, and we cannot expect the good competent research. Smart failure. So I said that there is no pass fail, but in competency based, if there is something is not working out, it means that it is a smart failure. Means that by doing mistake, the students know what is right and what is not right. So the failure will teach him how to do the good things. So that is a smart failure. So this smart failure should be recognized and should be corrected appropriately, and it should not be criticized. So the students who is doing mistakes, who is not able to succeed at the first time, he has a strong foundation of knowing what is not right also along with what is right. So this should not be criticized. And empowering and distributed leadership. So the students and the faculty together sit and decide what is to be implemented, how it is to be implemented. Or it is not that one person at the head position decides that this is the rules and regulation and you follow this. That will not work out for this thing. So the institution should be willing to distribute the leadership power to the faculty as well as to the students. Also, they should empower their faculty and students to make the right decision. So these are all the purpose of the competency based, and we need to design in each aspect under the 6 criteria. So these are the fundamental of the purpose of competency based education. Next is the teaching learning design. There is no right instructional method in competency based model. So there is no single instruction method says that it is suitable for competency based. So there are references for the type of learning experience, instruction and assessment. That is a curriculum. The curriculum will give whatever DCA is going to give for us, as well as the institution should prepare their own curriculum for the competency based. So in that we have to give a references of the learning experience, how we are going to teach, how we are going to assess. So the students are mastering in knowledge, skills, and their other qualities. So it should be the verily a reference. It should be, we have to implement more and more, and it should keep changing. So once something is not right, it has to be modified. Something is going right, it should be even more scrutinized. So like that, it has to keep changing, and we should not go for a fixed type of state. So the teaching learning design. So first we need to create a blueprint. How we are going to design, what we are going to design about the teaching method, learning method and assessment method. So prepare a blueprint. So from the day one, we have to start with our blueprint in every department for every particular competency. And then we have to streamline all the pedagogical competencies. For example, we have to, our competency in every subject, it might be diagnostic competency, a procedural competency, or therapeutic competency, communication, or the leadership competency. So there might be broad categories that should be fit into the course. That is, every specialty is a course. So these broad competencies should bring into the every courses, every specialty in otherwise. Then that should fit with the institutional goal. So what are the competencies expected by the outgoing students of the particular institution? Then that institution goal competencies or the key competencies should match with the national competencies, whatever DCA says. For example, I will tell. The DCA has only 2 objectives, because the objective should not be very, very extensive. So it has 2 objectives. The second objective of DCA, what it is telling, what the competency it is expecting is, the graduate should understand about the community-based oral health instruction, and they should participate in the rural oral health care program. So this is one of the competency expected by our national curriculum. Okay, what the Anbarasi University institution says. So they are telling to cater the diverse group of community and arrange for extension programs to serve for the rural people. So it matches. So the national goal is to do the community service. So the Anbarasi University is also saying that they wanted to go for the diverse culture service, and they will go for the extension programs. What the Faculty of Dental Sciences, dental program says, they are telling that they will serve for the underserved people. So the underserved people through the community program. So it means that they are willing to do the community service, and for that they may have the number of objectives or the sub-competencies, how they will train their students. So it all match. Now I'm not able to see what the competencies they included in every specialty. For example, what the competency they have included in the oral medicine and radiology to meet the community goals, or in the oral surgery, what are the things they are keeping in their curriculum to meet the community. Similarly, in every specialty. So it has to be aligned. So it's not from the every specialty to the overall program. the BDS end, and then with the institution, and then with the national goal. So this should be streamlined. So every competency in one or other way should match with the program competency, and program competency with the institutional outcome, and institutional outcome with the national outcome goal. So this is the streamlining of the pedagogical competencies. Then we have to pragmatically prepare the sub outcomes. So the outcome might be broad. All the students passing out of Ramachandra institution should be able to deliver a good community service. So that is very broad competency. So again, I have to split it into the sub competence, sub outcomes. What I'm expecting, the student should do the community preventive program. The student should be able to deliver a community education. So like that, I have to split the sub competencies. And then what is the transition goals? Suppose something is not working out or some challenge comes suddenly. So how I am going to adjust that situation? So for that I need a plan. And then stage objectives. So how I am going to execute. So these are all the things I need to prepare before going for the teaching and making the students learn. So these three things. And again, we need to eliminate all the ineffective rules and practices which we are having, and maybe they are historically proven. I was undergoing all the things during my period, and not necessary that I have to implement it for the present generation. So if we feel that it is not effective, then we need to remove. Suppose something is not going to get practiced on the society, then that should be removed. So no need to waste students, or the students cannot perform competently. For example, I can say a best example, the prosodontology, complete denture. The student cannot become competent. All the student I'm telling, all 100 cannot become competent by doing a 3 complete denture. Maximum 3 or 4 only nowadays institution are able to provide for the 100 students in a year. So it is not possible. Then it is better to eliminate that skill. Instead of giving an experience of incompetency, we can remove that. They can aware of that. They know they can expose to the various steps and the methods, but no need to judge the competencies. Not necessary that our one of the expected course competency is to perform complete denture for the needy patients. No need to that. So they should be able to do the lab work, or they should get an enough understanding or observation. No, so those kind of things we can include, but not that we have to judge them their competency. They cannot prove their competency with the end of doing 3 dentures. So like that, we need to eliminate certain ineffective rules and practices. And the teaching should focus towards the application. It is not that the student should acquire knowledge, skill and attitude because of my teaching. They should be able to apply the knowledge, apply the skill, right attitude towards the patient care program. So that is, it should shift from the know part to application part. And the assessment should provide corrective information. It should not give at the end day that you win or you lost. So it's not like that. It should give the corrective information. So a proper feedback is mandatory for all the assessment. And finally, all the teachers should have a common language. If I go and say that something is right or this is a way of doing, and the other person is coming and telling that this is the way of doing it, then the student will get confused, and finally we cannot go for the transparent competency criteria. So we need to prepare a standard operating protocol for every competencies, and then assessment rubrics, how I am going to assess each and every competency. So this we have to prepare. We need to start prepare from this point of time. So this is the basic work what we have to start on today to go for our teaching learning in the competency based mode. Also, the pedagogy design should place the learners in the center, never the schedule or the course structure. For example, the thing should not that they are in the first part of the first year, second part of the first year, or the last part of the first year. It should not go like that. So I will give the importance topic in the first period, middle period little bit easy, third period all the non-core copy. Like that we should not schedule our teaching. It should be based on the learner's interest, what they need. First you design. So what posting you want at the last, what type of topics you like to go in the beginning of the course. Like they should be empowered in the decision. So the pedagogy design also include the learners. And we need to prove through the assessment that all the graduates will attain the competencies at the end of the program. So the assessment should be so valuable and so properly arranged, and it should do its business, that it should assess the competency in a very transferable way. So the assessment need to be fine-tuned. Then the learners need to be sensitized about the strength and limitation of the competency-based education. Without knowing or without knowing the limitations, only with the success mood, if they come, it will not give the real success. So they should know both. What is the strength, what is the limitation of competency-based education, and they need to get prepared. Not only the teachers should get ready for it, the students also we get ready along with the teachers to go for the new form of education. And then nurture the growth mindset, so that our students should able to go for the specific skills like goal setting. So they should be able to decide what is next, how they are going to progress, and conflict resolution among the friends as well as with the faculty. So all this kind of growth mindset should be there. They should not keep enmity, or they should not turn off the faces. They should not be without any proper communication, it will not work out. So all the small things, the growth mindset should be inculcated both in the faculty as well as in the students. So these are all the additional things. At the same time, when we are designing the teaching learning, we need to be very careful that what the DSA is going to give for us is all the competencies in the form of observed performance. So they will tell that do this, assess this, assess this, assess this. But as a teacher, we need to take sufficient effort to introduce humanistic competencies like accountability, empathy, innovation, curiosity. So all in the day-to-day practice. So not we have to go only by the observation of the performance. We have to inculcate these humanistic competencies in our curriculum in a very systematic way. And then the competencies are stated in the form of minimally acceptable performance. So which does not do any harm to the population, which is to an extent satisfy the needs of the patient care. So it's a good enough. It does not give the excellence. So we need to craft a genuine kind of professional excellence in the curriculum. So we should not stop exactly at the level of competency. We have to give a chance for the professional excellence also in the curriculum. So these two things we have to be very careful. Once if we receive the guidelines from the DSA, we need to do these two things in our own institutional purpose. Finally, the structure design. So we know what is a purpose design. We know what is the teaching learning design. Now the structure design. So the structure, it refers to the operation, processes and policies that should be incorporated in teaching and learning. So the operational design, process design and the policies. So we need to modify everything, what we are doing today, everything to support the students to become competent. So we cannot follow the same operative protocol. For example, it is not right to say that the college will function between 8 and 4 and you have to do everything and you have to become competent. So we have to give a more time for the students. Maybe they want to use extra lab hour. Yes, that operation times should change. And again, I will conduct only 3 internal assessments. So within that you have to prepare. It will not work. One summative exam, it will not work. When the students get ready, we need to give 1 or 2 more chances. So the operation methods should become flexible and it has to be changed. And the process. So everything, how my day-to-day activities, everything should get changed. And the policies, it should not be rigid. For example, I said that leadership policy. No more it will be decision of the single person or a team of people. Everyone should be involved in decision. Everyone should be empowered in taking the decision. So all these things should be changed. So in the organization, if you get a single output, we need a more input. So the organization in everything they have to be consistent in whatever they are implementing. It should be transparent. Everyone should know the hidden agenda and what they are meaning clearly. And it should be flexible. It should not be very rigid. Similarly, first, professional learning. So the institution should spend a lot of time and money for the faculty to get trained. So that is the professional training for the faculty to meet the competency requirement. And it should be continuous improvement. It should evaluate the effectiveness and efficiency of the program and go for the next level. So the institution should do auditing. The management should do the auditing of the teaching learning process and the day-to-day functioning and go for the next level of improvement. Again, advancement in the competency actually. When we are implementing first, maybe our expectations, what outcome you are expecting maybe at the borderline. Then every year you should gradually go for the next level of higher order. So these are all the 3 things from the organization point of view. So the organization should give you a proper faculty development program. You should do the audit for the continuous improvement and you should keep advancing the outcome competencies. From the management level, so the administrators, they should go through the organizational processes for the efficiency and effectiveness. So continuously they should work on that. It should not be once in a while. In the year beginning, I will implement certain things and then I'll go back and let the constituent faculty should handle that. It should not happen. So the administrators should work along with the faculty and the students and the supporting faculty to go for the effective delivery of the program. And then the faculty team, they should be very innovative in designing the teaching learning component, assessment and personalized method of teaching. So administrators, faculty along with the external experts, because they have to evaluate the curriculum. Once if you are doing and we evaluate, sometimes we may miss something. So it has to go for the external evaluation and it should be open to incorporate the changes. So if you do all this, our institution will stand out. So because everyone is going to follow the same manual going to be given by DCA. So how we will stand out? By incorporating these things. So this is all for the management structure. Okay, now we know how to design the purpose, how to design the teaching learning, how to design the structure. Now we have to have some take-home assignment. So there is no message, only assignment, because we have to find the resources and learn on our own. So the faculty perspective. The faculty should find out what are the different ways to motivate and engage my students. So day one, you have to go and search and how I can engage my students in the classroom. And then we need to find out what the research is telling about effective instructional practice. So how effective? So if I have to deliver a content, in what way, if what I do, it will be more effective. So those kind of things, stuff we have to search on the research-based research. And then what are the types of assessment available and what role do play in achievement. So each assessment has its own plus and minus, or each assessment has its own strength and limitation. So that should be assessed and used judiciously. Then only it will be success. So we cannot give the same assessment, that is or only two set of assessment for everything. We need to design multiple set of assessment. And then what type of learning experiences are needed to help the students to reach the graduation goals. So learning experience, again, it is very essential. As I said, that it's not only in the classroom, it is outside the classroom. It is not only the one form of learning, it's a multiple form of learning in multiple domains. So that we need to think. Finally, thinking the today's situation, today's scenario and current student population, their academic needs and their lifestyle and learning experience, how these all give you information to go for your pedagogical approach. From this level, by knowing this population, how will you design the pedagogical approach on the competency mode? Now, these are the existing population. So based on their interest, how will we design the competency-based mode? So this is a good homework. Then only we can apply it for the current generation. So these are all the things what we have to work. We have to start work individually. Every faculty should do this 5 exercises. And the management. The management should plan how to support the students and faculty. So what I'm going to give for my faculty to become a competent trainer. How I'm going to support my student to become a competent learner. And what is my scheme? What scheme I am having to empower my staff and students, because they have to take a decision. So how I'm going to empower them. And what the policy I'm having to introduce shared leadership, because leadership is something which is very possessive. So how I'm going to share that with the teachers and students, so that what policy I'm having, because everyone also cannot take up the leadership role and everyone also cannot decide the decisions. So it has to be in a very cumulative way. So what plan, what policy I'm having for that. And finally, what are the ways for services and collaboration? So how I'm going to collaborate with the other national level or international level or with academia or with industries. So these are all the things how I'm going to do that. What are the ways available to do the best service for my stakeholders? So these are the management should think before implementing the competency-based education. So we are in a situation to shape the future. So today we are standing to shape the future. For that, we need an innovative mindset and a problem-solving attitude. And these are the 2 major things to work for the competency-based dental education in a successful way. So an innovative mindset and the problem-solving attitude. These are the 2 basic things that every faculty, every management and every student needs today. So to conclude, to implement the effective and the potential competency-based education in our institution, We need finally a 4 point. Whatever we design, okay, that should be a student-centric approach. So it should be a purpose, it may be a purpose, it may be a structure, it may be a teaching learning method, all should be on the student-centric approach. Second thing, there should be a shared leadership and empowerment in decision making. So not a single person decision, and it should be disseminated to the entire institution. So it should be a shared leadership. And faculty involvement, the faculty should be committed in what they are doing. They should do it on our interest. It is not that some compulsion or this is the rule or finding a way of escapism, nothing. The faculty should 100% involved in implementing the competency based education. And the institution as well as the faculty should have a continuous commitment to support. So the management should take all the effective, because it is very time consuming. It is need a more financial support. It needs more manpower based on the existing faculty structure. For example, the minimal requirement dictated by the DC, with the number of staff, we cannot go for the competency based. So there are a lot of things. So the management should consistently support. Once they are going to the next step, it has to revised, and it has to be improvised. So the facilities should be improvised by the continuous commitment of the management. So these are all the four steps we have to keep it in mind when designing the competency-based education for the successful implementation. So these are all my key references. And this presentation is it's a collective idea of my beloved guide, Professor Vijay Raghavan, and our Dean Education, Dr. Lata Ravichandran. Also Dr. Kandasamy, who I can never forget, because he is the one how to incorporate competency in dentistry, because many times people say that dentistry is already competency based. So what you are going to do new? So sir used to tell me that you will do everything new. So like that throughout my throughout my PhD period, he is the one who is the pillar of the entire work. And not but least my HOD, Dr. Arvind Varya, who used to support me, who used to relieve me from many of the department work and go on my fashion, in which I am competent. He allowed me to pursue on that. So I sincerely thank all these people, and especially to Dr. Vidya ma'am, who has identified and has given a chance today for me to address the vibrant NPIA faculty team. Thank you, one and all. So now I'm open for the questions and critic comments.
Now I request